Okay, I'm probably keeping you from a break, right? On a Friday, beautiful Friday, so I'll try to keep my remarks brief, but I'm really excited. And thank you, Dr. Diaz, for the introduction, and thank you, Elena, for the invitation, and Dr. Seguna sends his regards from HRSA. Unfortunately, he couldn't be here today, so he sent me, so bear with me. Also, this to me is a little bit of seeing some old friends. I see Dr. Campos out there, who I had the privilege of working with at a community health center for many years here in DC, and Dr. Rios, who actually NHMA supported me during my residency in the residency leadership program. And prior to that, I was a health policy fellow at the Office of Minority Health with under then Assistant Secretary Clay Simpson. So it's good to see a lot of familiar faces and obviously people who have influenced my career and trajectory. A little bit about myself. I come from Guatemala. My parents came here illegally. I'm the first in my family to go to college and obviously medical school. And the reason I share that is because I think Elena's remarks about how families are, or at least our Latino Hispanic families, aren't encouraging our students to go. Certainly that was not in the framework of my family's discussion, as they often work 2 or 3 jobs to support us. But certainly doing your best, working hard, trying to achieve was always values that were certainly instilled in our family. So I would just like to acknowledge my parents and my family as we certainly strive to have more diversity in health professions. So the Human Resources Services Administration, we have as our mission to improve health equity across the country. And we do that by addressing health workforce across the country, making sure that particularly rural, vulnerable communities have access to high quality care. Every year, HRSA serves tens of millions of individuals across the country through our various programs, and I'll go over some in my remarks. But certainly our mission is to address and improve the health disparities across the country. So we certainly work on that day in and day out. I will move the next slide here. So through more than 90 programs, HRSA strives to achieve this mission and its goals. Every year, as I said, over tens and tens of millions of individuals are impacted by our programs. We have 90 programs that really aim to improve health equity across the country. We provide over 3,000 awards to various organizations across the country, including community-based organizations, nonprofit organizations, hospitals, tribal, state, local governments across the country. And every year, again, HRSA's programs not only impacts the care that individuals receive, but also the quality of care, not only in terms of mothers, pregnant mothers, through our Bureau of HIV and AIDS, obviously the Workforce Bureau that I help to lead, the Health Center Bureau, which cares for over 26 million individuals a year, certainly a strong program in delivering high quality care. So roughly 1,400 health centers across the country, as I mentioned. I worked at Unity Healthcare, which was one of those organizations, are providing care to 26 million individuals across the country. Dr. Rios mentioned in her remarks that NHMA is really focused on family-centered care, and this is certainly the case among community health centers, where patient-centered medical home is really at the core of what they do. The vast majority of those 1,400 organizations have already achieved PCMH recognition or accreditation, so that certainly is an emphasis in the program. Again, 1 in 3 of the patients that they see are living in poverty, 1 in 6 are rural residents, 1 in 10 are children, and they're currently serving over 330,000 veterans through the care, but really striving to address those factors that impact our community's ability to control their chronic diseases. The National Health Service Corps, and this is obviously a program that I'm very well familiar with. It's been in existence now for over 40 years, but I'd like to highlight the connection between the community health centers and National Service Corps and Nurse Corps programs. Over 60% of our current field strength, and that right now is over 10,000 clinicians who are physicians, nurse practitioners, nurse PAs, psychiatrists, psychologists, are serving at community health centers. So there really is a strong link between the community health center program and the National Service Corps, and there will continue to be that strong link. As I mentioned, our current field strength combined of these two programs is over 12,000 clinicians. We support those clinicians at the various points of their education, from students through our scholarship program, to fourth-year medical students and fourth-year dental students through our S2S program, into service through our loan repayment program. And again, the majority of them are working in community health centers, and not just there, but also at tribal sites, at rural health clinics, and really are a key safety net and workforce for those organizations that are delivering critical services to those communities. So a little bit about the Hispanic Workforce Snapshot and the National Service Corps. We have within the National Service Corps the ability to recruit disadvantaged students, those that are coming from disadvantaged backgrounds, and that really is the leverage that we apply to try to get a diverse workforce within our field strength. So what we see here is 13% of our current National Service Corps clinicians identify themselves as Hispanic. When we poll our clinicians, over 65% of them self-report that they speak Spanish and utilize that on their daily basis in delivering care. What we see within this program, the Nurse Corps program, is that the numbers of Latinos and Hispanics that are represented in each of those disciplines clearly is more than the national average for those disciplines, whether it's in dentistry, nursing, medicine, PA, nurse practitioners. So the National Service Corps really strives to focus on the diversity of its clinicians across the country, knowing that increasing the diversity of that workforce really impacts the quality of care that those communities receive. In terms of our diversity programs, and as was mentioned previously, if the omnibus bill is signed, what we'll see is a dramatic increase in some of our funding lines, not only in the National Service Corps, but in many of the diversity programs and pipeline programs that HRSA administers right now. And we know that increasing health profession diversity leads to improved public health by increasing access to care for underserved populations, but it also increases the opportunities for minority patients to see practitioners in whom they share a common race, ethnicity, or language. And we know that this helps improve their adherence to chronic care delivery, and improves ultimately outcomes. So we understand, and we certainly feel very strongly about increasing the diversity of our health program, of our health professions across the country. And we do this with a number of programs. I think some of you may be familiar with almost all of them, but I just want to recap some. Our area health education centers, which really is a partnership between community and academic organizations to increase not only the diversity, but distribution and quality of training that these health professionals receive across the country. A total of 437,000 students have received training through our AHEC program in academic year 16-17, and 18% of those students self-identify as Hispanic or Latino. Our Center of Excellence program, which supports health professions, schools, and other health or educational entities to enhance the academic performance of underrepresented minorities. And through that program, we have 164 COE-funded structured programs with more than 6,800 students who were trained in academic year 16-17. And again, 37% of those students self-identifying as Hispanic or Latino. So really critical diversity pipeline programs in those two areas. But again, our Health Careers Opportunities program, and this is a program that not only tries to increase the health diversity of health professions, but also support those students in academic performance. And we're touching individuals as early as their sophomore, junior year in high school through that program. So really, what we're trying to do is address that pipeline, that continuum of health education and health professions, from education, training, all the way to service. And if I could just highlight that continuum for a moment, because the Bureau of Health Workforce in HRSA has over 40 workforce programs. And we're really trying to emphasize that continuum, because we know that there's a connection of those over 10,000 clinicians who are in the National Service Corps. We know that a number of them have been participants in these programs, in these pipeline programs. And we're showing that continuum more and more through our analysis of the data and tracking of those individuals through the continuum of that training in those programs. Just continue on, I'd like to highlight our nursing workforce diversity program. It's helping to create a more diverse nursing workforce. And this is an area where I think all of you recognize Latinos and Hispanics have been somewhat well represented. We have a large percentage of RNs who are Hispanic Latinos, and this program helps to train those individuals. A total of over 4,400 trainees participated in that program in academic years 16-17, and over 25% of those were self-identified as Hispanic or Latino. And lastly, I'd like to mention our scholarship for disadvantaged students, because obviously for individuals who don't have that economic wherewithal to complete their health professions, it's really challenging. I wouldn't have been able to complete my medical training without the National Service Corps providing me a scholarship. Similarly, the Scholarship for Disadvantaged Students program helps to increase the diversity in health professions and nursing workforce by providing grants to academic institutions who then in turn provide scholarships for students from disadvantaged backgrounds to complete their health professions training. So community-based training, again, this is, again, the continuum that I mentioned in terms of education and training to service. We have two major programs that support this effort. The first I'd like to talk about is the Children's Hospital Graduate Medical Education Program. And this supports the 57 freestanding children's hospitals across the country. And I think people are often surprised when I mention that almost half of our general pediatric colleagues come from these hospitals. Almost half of our pediatric practitioners come from these hospitals. And the vast majority of the pediatric subspecialties come from this program. And these are pediatric, general pediatric providers and subspecialty providers that are really providing critical service to often Medicare recipients. So some of the most vulnerable families and children in our country are being supported by this program. The other is our Teaching Health Center Graduate Medical Education Program. We currently support 57 grantees, actually about 732 FTEs of residents. And what's unique about this program is community-based. Unlike other graduate medical education programs that are really focused on a hospital setting to provide that training, this one is entirely based in either community health centers. The majority of them are in community health centers, or in rural health centers, or Indian or tribal sites. But over 60% of them are in community health centers. And why is that important? It's important because it changes the paradigm of graduate medical education. It acknowledges the fact that the more you expose a student or a resident in a community-based setting, the more likely they are to practice in that area. And what the literature shows is when a resident completes their training, they're likely to stay within a 50 or 100-mile radius of that training. They're likely not to go back to their state. So if you went to medical school in California and you did your residency in Florida, you're likely not to go back to California. And that's why this program is so important. We recognize that where residents are completing their training, they're more likely to stay there, and we want to encourage them to stay in those medically underserved areas. So our Rural Health Policy Office, which is led by Tom Morris, who really has been a champion of rural health policy for many, many years, supports the Office of the Secretary in terms of rural health, but it also helps to administer some rural health programs and networks. And since 2012, the National Rural Health Association has trained 755 community health workers, the majority of whom have been training in the U.S.-Mexico border. And are Hispanic and of Latino descent. And most of these trainings are conducted in both English and Spanish, so an important component to diversifying and supporting community health workers in those areas. But it's also been supporting telehealth through its telehealth network grant program, and since 2005, supported over 3,100 new or expanded telehealth sites, nearly a 10% increase since 2015. And again, this is really important because no matter what we do in the area of workforce, we're unlikely to be able to generate enough health professions to deal with the over 16,000 health profession shortage areas across the country. It's important for us to support the expansion, the acceleration, the modernization and adoption of telehealth technologies, particularly in community-based organizations that are really providing critical services to vulnerable and underserved populations across the country. And I just want to end with a little plug, and that is that HRSA has been conducting virtual job fairs for some time now, a few years now, but we are going to be kicking off a virtual job fair April 11th, focused on behavioral mental health. We now have over 100 organizations that are going to post 1,000 vacancies. We're hoping to encourage 3,000 clinicians who are looking for careers in mental and behavioral health disciplines, particularly at areas that need them the most. So please leverage your networks, encourage those clinicians who are looking for careers in those areas to participate in our virtual job fair on April 11th. And please stay connected to HRSA. Thank you.